everybody to use of notes to file in the clinical trial essential documentation. That title is long, but it includes some very heavy words. These are going to be filed, notes in the file. They will become essential documents. That means the FDA is going to be looking at all of those if there ever is an inspection. Any other regulatory authority from another country might be coming to the site and would have access to those notes to file. We're going to learn today that some of them are in the sponsor file. Some of them might be only in the site file. All of them would be considered essential documents, so we need to keep them all. The lesson to take home today is that we're using too many of these. I get to see a lot of these in today's environment at sites as well as auditing sponsor files prior to the FDA coming in to do an inspection. Some of those notes to file add value. Some of them do not. We're going to look at the proper use of them today and remember that they are all going to become essential documents in a clinical trial. They're all going to have equal weight to any source document that's in that file. So at the end of the session, I hope that you can make better decisions as to when and how to use those notes to file appropriately. I believe that all the attendees today are CRAs or people working within the CRO environment, from what I've understood. Do all of you go to sites? Give me a green check if you go to sites, a red X if not all of you go. We might have some management folks that don't go. Okay, so everyone on the line is going to sites. Okay, great. That means that you see those notes to file, whether your company has written them, whether that means the company being the sponsor, whether the CRO has written them, whether they come from a vendor, like a laboratory perhaps, a central lab might write notes to file for the site, or whether the site themselves has written the note to file. Give me a green check if you as a monitor ever write a note to file for the site. Okay. How about a green check if you write a note to file for the sponsor file? Okay, so you're doing both. Okay, great. We want to look at how to use them. As we move here to our objectives today, we see a number of warning letters that are available that reference notes to file during inspections by the regulatory authorities. Many of them, unfortunately, do not support the documentation that the agencies are looking for. They very often are red flags, in fact, to highlight discrepancies and don't serve a purpose other than to say, hey, we didn't do this right. Oh, we didn't do it right again. Oh, guess what? We're still not doing it right. That's not the purpose for a note to file. We don't want those kind of bookmarks in there. So we're going to talk about the current overuse and the misuse of these notes to file, including some FDA warning letters where they note deficiencies in the interventions that include the note to file. And we see how they use them. We're going to identify what is an appropriate note to file, whether it be patient-specific or non-patient-specific. We'll see a template for writing an effective note to file. And we're going to reference industry tools such as the warning letter that relates to those. As we get started, we need to identify what is one. What is a note to file? It might be called a memo to the file. It might be a letter. It could be written by almost anybody. It's commonly used again as essential documents in both the sponsor and the investigator files. The content is what we're looking at. Many times it doesn't serve the purpose. Why did we write it? What's the use of it in this file? It might not serve any purpose at all. It might just be redundant. It might just point fingers to where things are wrong. We have one warning letter we're going to continually look at today. This one happens to be from a Dr. Lawrence, and it's in your handout. I've identified this on the slides by paraphrasing pieces from it. Your handout has the complete document that we pull off the internet.